Mental health issues are far more common than most people realize. According to the U.S. Department of Health and Human Services, 1 in 5 American adults and 1 in 5 American children have experienced a mental health issue. Those statistics alone are causes for concern. However, the barriers to mental health care access are even more alarming. Today, only 41% of adults with a mental health condition receive help, and less than 50% of children ages 8 through 15 receive mental health services. We know there is a critical need in our own community.
I've had anxiety since probably I was born. We just put a name to the demon when I was in 8th grade, because I was be up all night before tests, and I'd be shaking, and I just finally decided this isn't normal. So I finally went to my mom and I told her I think I need help. When I was in my junior year, it just kind of hit the fan, and I just I lost almost complete control of my anxiety. I had a lot of anxiety attacks almost every day.
She was able to take college classes in junior year because she was a really, really good student. And then it got to the point where she couldn't make it to school. So you take college classes, you need to be there. So she had to drop them. She was lined up for scholarships, and she couldn't make it to school. So she lost everything.
I was devastated. I had this huge plan for my future. I constantly had suicidal thoughts. I remember thinking I was losing my mind, and I was so angry. And I was just baffled, I couldn't possibly figure out what was wrong with me.
This doctor here in town, let's go see her. I said, if you don't like her, cool, we'll keep looking, but let's go see her because I really like her. So I took her for a meet and greet, and I kind of left her in there with Dr. Thomas and stepped out because she's old enough. You need to form your own opinion, not me. So
I really liked her. I was just oh my God, Mom, she's so cool. And so then I found out that she actually does mental health too, and she does medications for that. When I went there and I found how understanding she was and how kind she was about it and how she actually understood what my thought process was and what goes through my head, it finally felt like I'm not alone in this anymore, and that I'm actually able to get the help that I need now. I am happy where I am, and I'm glad I am where I am.
Today, primary care providers, the doctors or nurse practitioners who provide day-to-day health care, deliver half of the mental health care for common conditions such as anxiety, ADHD, depression, behavioral problems, and substance use. Yet, people with mental illnesses who are treated in a primary care setting and then referred on to a mental health provider are less likely to receive effective behavioral health care. But why? Because the new provider is unfamiliar, they don't have the right kind of insurance, or they're scared. When a doctor refers a patient to a mental health provider, only about half of patients follow through with making an appointment. As a result, many behavioral health problems go undetected, undertreated, and/or untreated.
It's estimated that 40% of patients that walk in the door in a primary care office on any given day have an active psychiatric problem. That's a lot. In order to meet that need, there's some really great innovative programs across the country looking at how we're going to solve this issue of helping those with mental health needs. The program definitely will not replace our need for psychiatrists. We'll always need specialists. It at least helps the primary care folks do more to educate themselves so that we can do more, manage more in the primary care setting. The wins, the saves in mental health, they're not as tangible, they're not as concrete as, say, saving someone from a heart attack. When you save them immediately and that wonderful, miraculous work happens and that person lives, it's easy to see those results. With behavioral health, it's a longer process. It's months, years in the making, and it might be those tragedies that don't happen. Maybe a job loss that doesn't occur, or a family that's not broken apart, or especially an overdose that doesn't happen because people that are suffering get the care they need.
In June 2017, we staffed our Braidwood Healthcare Center with a dedicated licensed clinical social worker, an LCSW, to provide behavioral health services for our patients. In coordination with physicians, our LCSW assists with mental health issues, substance abuse, social work, counseling, and children and family therapy. In this first integrated site, our LCSW is already fully booked, seeing 6 to 8 patients per day. 40% of those patients are children, and 85% are Medicaid. And we are already seeing results.
At the time my son was married, him and his wife were doing heroin. They had 4 children. DCFS called me one day and said, we have all 4 of the kids. And now I have 4 kids that were placed on my doorstep basically with nothing. We had no clothes, we had nothing for them. And I, through this whole thing, have been the rock. I keep everything together. I keep everything going. I keep, everybody comes to me. A lot of, we didn't tend to ourselves because we had to put so much into the kids. Then all of a sudden I started thinking suicidal thoughts. If Morris Hospital did not accept our Medicaid, finding a doctor or a social worker or a psychiatrist that does accept it is very out of reach. It's very out of reach. And the problem with that is that then people give up. So with Abigail, she, all right, well, you need to do something for yourself. And I can honestly say that I have not had one suicidal thought. Not one suicidal thought since being on the right medication and getting the right help. I'm not saying I'm great. I'm not saying I'm perfect by any means. But I am way better with the help. And my family is way better with the help that I get. Because without it, it would be, I can't even imagine how bad it would be.
Lana and Brittany's is an incredible and difficult journey. Every child, young adult, and senior citizen living in our community who needs behavioral health treatment should receive high-quality services without stigma or barriers to access.
I think the term behavioral health is a newer term, and I think it helps with the stigma of mental health. Like, I think when people think of mental health, they think of people with schizophrenia or bipolar or these severe mental illnesses. But when I think of mental health, I think of just like this holistic approach. I mean, it can deal with someone struggling with their mood or their behaviors or just the way that they think. And that really plays a huge role into their daily life and how they function. Because when people don't feel well, they automatically go to their doctor, whether they're not getting enough sleep or their heart's racing or they just don't have motivation or they don't feel well. They go to their doctor. What happens then is it has that connection to link them to services that they need. Because with depression, they could not be sleeping very well or don't have any energy, poor concentration, just lack of motivation to do anything. And that way their doctor can say, okay, I don't think this is a medical problem, I think this is more of a mental health problem. But I think people feel a lot more comfortable going to their primary care doctor.
Our experience at this one healthcare center has taught us that the primary care setting is the gateway to behavioral health. Our goal is to expand these services for more people in the communities we serve, but we need your help. Your support will allow us to expand the primary care model by hiring more licensed clinical social workers and advanced practice nurses for more of our healthcare centers. Your support will assist the hospital in educating our physicians, clinicians, and staff by funding psychiatry fellowships and other trainings. Your support will allow us to continue to facilitate and work on multiple countywide projects, including funding support groups and task forces. So far, the hospital's annual expenses for this program exceed $228,000. That figure will grow as the program expands. Your support will enable us to move quicker, serve more, and treat better.
Anyone struggling with mental illness and reaching out for help deserves our attention and compassion. But it's our responsibility to make that happen, and it will require all of us working together. With your support, we will build this program and make a real difference in the lives of others.